Hello, this is Dr. Turkmani, and this is a case of cataract surgery with lens implant and DSEK for corneal decompensation. Many decompensations, whereas bothersome for the patient, they may not difficult significantly the cataract operation. In this case, I start as per my usual Phaco technique with 2 paracentesis and 1 main incision. I've marked there with gentian violet 4.5 millimeters for the subsequent DSEK incision for the injector, but I started only with a 2.2. Then after filling in with viscoelastic, I'm doing my capsulorhexis in the standard fashion. So there it is, continuous curvilinear capsulorhexis. Then I will proceed with hydrodissection. And after hydrodissection, I am going to rotate the nucleus with a modified Rosatelli spin. Let's say instead of doing a full spin like Dr. Rosatelli, I just do movements back and forth. So I put the chopper all the way towards the equator, and instead of doing full spins, I just do a quarter of a spin back and forth. You may call it sweep and rock if you want to call it this way instead of sweep and spin. Then I had to change the chopper because that chopper was blunt for the actual chopping. So here I'm using a greens chopper for my usual horizontal chop technique, and I would chop the cataract in 4 to 6 pieces usually. So here I'm continuing with my chopping maneuvers. And then after I'm satisfied with the chop maneuvers and the size of the cataract fragments, I would proceed with the phaco emulsification. So nice and clean chops there. And then I'm removing the first fragment, and then I will remove them all one by one until the full cataract is removed. There we are on the last nuclear fragment, and then I'm removing the epinuclear shell. I'm putting the chopper in the safe position to protect the capsular bag from coming to the phaco tip, and now I'm doing aspiration with bimanual IA. And finally I'm planting the lens inside the capsular bag, after which we will proceed with the DSEK. So I'm using a blunt instrument there to score and then peel the Descemet's membrane with the aid of reverse utrata forceps. After Descemet's has been peeled, I am loading in the injector a manually dissected DSEK lenticule. I have other videos in the channel on how to manually dissect a DSEK lenticule. I've marked it with an F stamp for orientation. The incision has been enlarged to 4.5 millimeters for the injector to fit, and I am using the irrigation line from the phaco machine to assist for the injection of the DSEK lenticule. I'm suturing the main port, then I am floating the graft with an air injection, and I would use that same needle to center the graft in position, only touching very gently in the periphery of the graft to keep it in a central position, and then a bit more of air for a proper tamponade and position of the graft, and finish the case with subconjunctival injection of Kefandex. Thank you very much for your attention.